Last up in the chemotherapy infusion center. So our topic today is very timely, at least for me. It is taking care of the caregiver during cancer treatment. So it's a family approach to supportive cancer care. And so today, as you can clearly see, I am with a friend, supporting them during a chemotherapy infusion this morning. So thank you all so much for joining us. I am delighted to introduce our guest today, Ms. Smitha Mallaiah. She is from MD Anderson Cancer Centers, the University of Texas, MD Anderson Cancer Center in Houston, Texas. She's worked there for about 10 years. She is an internationally recognized expert in yoga research in cancer care and the clinical application of yoga in supportive cancer care. So I'm delighted that she has agreed to join us today. MD Anderson has a really marvelous integrative medicine program in their cancer center. And one of their pilot programs, their flagship programs, is family support and working with couples. So Ms. Mallaiah will talk about the couples yoga that she is doing research on and that she has created a protocol for. So she is a senior mind-body integrative specialist at MD Anderson. She has a Master of Science in Yoga from SVYASA University in Bangalore, India. She's also a member of the SIO Yoga Special Interest Group, and she is the program director for SVYASA USA. And she speaks around the world on this topic, and she has contributed to many publications. So this is intended to be an interactive session for your questions. So Ms. Mallaiah will begin with a very quick PowerPoint presentation to give you some background about the importance of taking care of the family and the caregiver during cancer treatment. And then she'll talk a little bit about the research she's doing and the actual practices that she works with her patients, in clinic during acute treatment. So I'm going to hand it over to Smitha. Ms. Mallaiah, it's all yours.
Thank you, Leigh. Thank you for a very gracious introduction. Congratulations and my best wishes for SIO as SIO has put together this wonderful platform for people in oncology and cancer care to come together and share ideas, thoughts, and useful information. So I'm honored to be here. Thank you for this opportunity. So as Leigh mentioned, the first few minutes, I would just like to use a couple slides to bring in and throw some light on different areas of this cancer care with the caregiver or the family. And then I would like for it to be more interactive, and then we will open up. Just a minute while I pull up my slides. Okay, I hope you guys can see the slides. So as Leigh said, the topic, a family approach to cancer care, and how can we use yoga practices to strengthen the bond between the patient and caregiver, or patient and family itself. So most importantly, why this is important. As we know, when somebody is diagnosed with cancer, a patient, there is a lot of emphasis and importance placed on treating the individual, which is of course extremely important. But as we know, cancer is not just like any other disease where you have a diagnosis, you have some treatment and followed by some prognosis and how things look and how we manage. But rather, cancer is a disease that affects the entire family. And while many caregivers actually consider it a privilege to take care of their loved ones, support them, encourage them through their cancer treatment. The side effects and the comorbidities of the caregiver itself is something that is not necessarily addressed in the context of cancer itself. So it becomes really important that we address this. Our second reason why this becomes important is the literature shows that caregivers themselves have clinically significant levels of comorbidities, health issues that are very important and are in need to be addressed. Say, for example, if I'm a caregiver for a patient, if I have my own doctor's appointments and things that I need to go get addressed, I would rather do them later because right now I have something more important on hand, that is my loved one going through cancer. So we have literature and very clear evidence of spousal caregivers are at extreme high distress and they need interventions. And secondly, also the caregivers who are in the front line and who work with cancer patients, also to recognize this symptom burden that the caregivers might be going through, and maybe to encourage or add interventions where this can be taken care of, this can be addressed. If the caregiver is stressed or under distress and have these kind of symptoms, and they go through their own healthcare issues that are not addressed, this can also directly impact the cancer patient's care, their ability to respond to treatments and treatment-related outcomes in the big overall picture. How they respond to cancer and cancer treatments can be linked to how well of social support and caregiver support they have from this. So I just have quoted a couple studies if you're interested to kind of like go back and maybe look at them. And again, why this interaction of social support, love, and connection is important in cancer itself. Cancer, there is a diagnosis of cancer, find the right, hospital treatment, get it done. Why is this important? Again, not to undermine, when we understand health, even from the definition of World Health Organization itself, it is, not just the absence of illness or infirmity, but a sense of complete health at physical, mental, social, and spiritual levels. And we know in cancer care that social support and social health plays a large role. And we know from studies, like one of the studies that were done by one of our professors at MD Anderson, Dr. Anil Sood and colleagues who, did this experiment in ovarian cancer population. Patients who had good social well-being, basically patient who had good social support and a good sense of social attachment, has shown that they lived longer, as seen in changes with certain markers in the tumor microenvironment. So we are talking about real science and not really just a sense of, you feel supported, you feel important, but actually this sense of social connection, showing on markers in the tumor microenvironment and thereby impacting the outcomes of cancer, which if you ask me, which is extremely important. Also, this was one of the recent studies that came out of just us socially connecting. And we have a great mentor at MD Anderson, Dr. Lorenzo Cohen, who brings out these wonderful connections in the most scientific lens that you can see. This one of the recent papers from the University of Chicago highlighting how connection with others, just as human beings, we know that we are social beings. We need that connection. We need that sense of, meaning with social connections and belonging that we need, where people who basically connected randomly to, random strangers, these are not people even from family or caregivers, but random strangers in subway, basically people who could talk and connect, had much more positivity for their, day after this connection was basically done. So if you think about a day in cancer patients' life while they are going through the enormous amount of stress included with high symptom burden, this could play such a large role, again, as I mentioned, not with just with a sense of well-being, but even with the healing and prognosis and outcomes of cancer. And when we look at some of the previous work done in just relationship, we do know mindfulness-based relationship work that has evolved and brought in highlighting some of the very important areas of relationship itself. And this particular work was done in healthy couples, not necessarily in cancer population, but the highlights of why this construct of bringing yoga therapy into this population becomes important. With this study, researchers basically found the mindfulness when you have a mindful connection with your partner and you're connecting to enhance and understand each other from each other's perspective, not from your own perspective. You see that it helped favorably impacting couples' levels of relationship satisfaction, autonomy, a sense of relatedness, acceptance of one another. And we see this while patients go through cancer treatment. The acceptance is probably something that plays such a huge role in where they are in present day time and situation. A lot of cancer patients are struggling with coming to terms with just the diagnosis itself and the changes that it brings in, the identification of who I am. So yoga and mindfulness can have a huge role in fostering these areas that is basically a huge gap in our care. There is a lot of addressing of the disease, distress, symptoms, but not necessarily an area where the relationship is enhanced or fostered so that the cancer outcomes can be supported. And again, here, I would like to point out connectedness, because that is something so important, and yoga, meditation, mindfulness practices can wonderfully foster this for the better outcomes for patients and families. When we talk about yoga for couples, again, I'm not putting up research numbers and slides here, but more, I want to have an interaction and hear from you guys about thoughts or questions that you may have. But summarizing the role of yoga therapy for couples, it's important that the sense of strengthening the bond, and most importantly, identifying that these relationships that we interact on, especially for spouses, family caregivers, these are rooted in love, and love that is unconditional, and support that is unconditional for each other. So in yoga, there is a saying, yogastha kuru karmani. You operate from the base of yoga. And in here for relationships, it is that love, trust, mutual respect. This is the ground where we operate and find each other. And the distress of cancer can throw off this grounding that we all need. And yoga meditation can definitely bring in that back to the couples, to the family, and the patients that are going through cancer. Apart from this, from the studies that we have seen, something very important for us to know is this doesn't only improve the well-being and symptoms of the cancer patients. Most of the studies that we have done, we have of course targeted the population or the patients that are going through. If we did work in head and neck cancer, the practices were geared towards the symptom burden of that particular population. But even though these interventions were geared, a main part of the intervention overall was to bring both parties, the patient and the caregiver, together. So this connectedness, this sense of interdependence. Usually cancer patients have this a continuous identification of, I am a burden, I need care, I need support. So it seems like a one-way road where one person is receiving and the other party is always giving. But through the yoga practices, it could be simple balance postures, it could be simple breathing practices, meditation practices. The idea of interconnectedness and the ability for both parties to support each other. It could be a simple support by a physical support in a posture, or it can be the support connecting at the mental, emotional level to support each other. So these are ideas and areas that a yoga therapist can work when she or he is working with patients and caregivers. We also have seen significant improvements, even for the caregivers, in the area of distress, depression, sleep quality, physical mental functioning, so on and so forth. Most importantly, the work that is required in this area using both patients and couples is not so much, at least there, when we look at 5 or 10 years ago. So most importantly, I want all of you to know that this is a very important work. It is feasible, it is acceptable in case if you are interested to continuing and working in this area, using yoga therapy for enhancing the bond and improving the symptom burden for both patients and caregivers. Let's see. So I just, even in the times of COVID, something that we continuously see is because of all the social distancing, the distance that we have between each other and the missing and the sense of touch and hugs. So just bringing you all that one tight hug and feeling that all of us are loved and connected, and most importantly, to both give and receive social support and love. Sometimes I've seen that with patients. Receiving is considered as, weakness. Asking for help is weakness. Receiving love is sense of like emptiness. Please make sure, and again, because of time, I'm not sharing into other studies. There are literature to show both receiving and giving love and support is healing. So with that, I'll just stop the slide share and maybe open up. I know I tried to use about 15 minutes of my time, and maybe we can open up for some questions.
Great. Thank you so much, Ms. Mallaiah. That was really great. I just want to remind the audience that as part of our Wellness Wednesdays, we always have a 20-minute experiential video that's posted on the SIO YouTube channel. And so Ms. Mallaiah has pre-recorded a 20-minute couples yoga and meditation video. So it will be available just after this webinar for you to, at your convenience. It's available on demand to take a look at the actual practice that can be employed or taught with the patient, caregiver, family. So let's absolutely open this up for questions from the audience. And we've had 4 questions already. So I'm going to start with those. And please write your questions in the chat box, and we will be monitoring that and asking questions as you write. So the first one, why is it important to do this yoga practice during the actual treatment phase rather than after into survivorship?
So as we know, the symptom burden for cancer patients and caregivers are extremely high during the treatment phase. And actually, for those of us that are familiar with cancer treatment and the outcomes and symptom burden of it, we do know a lot of times high symptom burden impacts the patient's ability even to receive care, to make the most important decisions that they can make. And treatment distress during the cancer treatment can also be tied into prognosis and the outcomes of the treatment itself. So even though this can be something that can be intervened at any point, and even the recording that is there on the YouTube, you can practice it with your spouse even though you're not going through cancer or you're not impacted by cancer. So it's always good to enhance that sense of relationship with one another. But most importantly, during treatment, because this can play a significant role in managing the side effects and symptom burden of treatment. So it can actually have impact and help you to directly feel, have better impact with the treatment, or the treatment outcomes can be better if you can include this during the treatment itself. So I highly encourage. And a lot of times, even when patients need to come into these classes, something that they mention is, oh, we are so busy, there's so much going on, so I don't have time for this. But the moment they come in and experience a session, they immediately say, this is something that I really need every day to be able to go through the stress and everything that I'm going through with cancer. So really having that conversation, if you are a yoga teacher, therapist working with patients, let them know that this is really important, that this will help them to cope with the treatment stress better. And Lee, before I forget, I need to really credit and acknowledge this whole work that we are doing with couples at MD Anderson is because of Dr. Catherine Milbury. So she's a social psychologist, and she has studied this area extensively. I had the privilege of working and with her to co-create some of these. And my expertise is, of course, as a yoga therapist, and she is a researcher that is interested in exploring. And that's how we both have worked together to do.
Great, thank you. So I have two more questions coming in through chat. This one I was expecting. How do we deliver this online in the time of social distancing? You know, are we able to share this via Zoom or telehealth delivery?
Absolutely. So since COVID, again, at MD Anderson, I work both on the research side and the clinic side, where we work with various research projects recruiting for particular populations. But on the clinic side, I have more liberty. A lot of us don't have that integrated into our cancer centers yet. But through this, we are able to carry out all the yoga therapy sessions just like we did pre-COVID. So we have Zoom built into Epic, and I'm able to see patients even for online, even working with couples. So I would almost see that it is exactly like you would do an in-person intake and consultation and do the sessions with them, where I'm mostly focused on patient and their symptom burden, but I also bring in the caregiver or the spouse, whoever is attending with them. And many of them actually reach out. Many of them reach out for couples yoga on the clinic side as well, wherein we can work together and bring in practices of meditation, yoga practice together. So I'm just being more careful in terms of slowness, working with their limitations, working with the contraindications, both for the patients and caregiver in this case. And that is something that can be delivered online. So in fact, at MD Anderson for integrative medicine, that is one of the modalities. We have acupuncture, massage, music, everything that you can think of, but yoga therapy is the one that is continuing, even in the COVID times online. And it is quite effective, and I would love and encourage others to pursue that if you are a yoga therapist or a teacher.
Thank you. Another interesting question. So and this is a regular viewer who comes in and is with us every week. He always has great questions. He said he hasn't watched the video yet, but he wants to know if the important part is doing yoga together, or is it in the actual doing the poses, the asana together, or the breathing or the meditation together, rather than just in the same room doing a practice?
Wonderful question. And this is something when we work with couples that we continue to, guide, where and especially even from the literature or sense of yoga, yoga is meant for self-development. And where is this two people coming together where I'm addressing the self less, but this connectedness aspect more. So when we do yoga with couples or patient and caregiver, the aspect of connectedness is very important. And again, connectedness, not just at a mental or emotional or spiritual level, but also at the physical level. So if you watch the video, one of the instructions that I start by is, can you face each other? Can you look at each other into your eyes? Take a moment to relax, take a moment to connect. Even when you go through the postures, it can be a simple movement or support from the partner. It can be practices that you can face each other and connect and do. So another aspect of doing these practices is, can you try and mirror what your partner can do, how much your partner can do, so that you really feel what your partner is feeling going through these practices. And especially you see this if one party of the partner is compromised with a movement or with another ability, you see the other person has to stop there, hold there, and really feel that. And that really brings in a deeper sense of connectedness, brings in a lot more patience towards each other. So to answer your question, Lay, it's not necessarily separate in the same room, but really connecting to each other at all levels with asana, the postures, with breath, with meditation, with relaxation, and everything.
Thank you. I think one of the most beautiful parts of the practice that you pre-recorded for us was that the idea that you can sit back to back, whether you're on the floor or whether you're in a chair, but your back is together so you can feel each other, and then you breathe together. You do the deep belly breathing, and you can really get into sync. And I think that is just so lovely. Yeah, and so please, everyone, go and watch the video and give it a try with your loved ones. We have time for just like 1.5 more questions. We have a great question here. What if the patient wants to do yoga and they're all for it, and the caregiver says, no, I don't want to do that?
That's a tricky one, but that is also something that I have seen with many dyads, many couples walking into our yoga therapy room. So we have one of the, maybe sometimes the patient who is like, my caregiver is so distressed, you know, he or she really needs yoga, even though I'm going through cancer, he or she is the one. So they drag in, they may want to do, they may not want to do, and things like that. So one of the things that I always offer to my patients and caregivers is give it a try once. And if you don't like it, if you feel like it's not something that you would enjoy or it's not suitable for you, then, you know, nobody is going to force you to continue. But why not have a open mind to try it once? And sometimes I would also use the research or the findings and say, you know, there is evidence to say that this is supportive and this is something that is good for you. And once they do it, I've had, I don't know, probably dozens of patients who come back and they're like, I need this. Because one of the barriers could be a lot of, excuse me, one of the barriers could be a lot of people may not have experienced yoga. And another barrier that people may have is when they have to silence, quiet their mind, they may be exposed to their distress and uncomfortable emotions more. Once they are over that hump, then they really feel comfortable and confident in continuing this. So maybe encouraging them to attend a session, not knowing that they're not bound to be doing this forever, can be a way. I've also had patients who might be having a very difficult day walking into the session, who almost are probably having an argument and don't want to see each other, or like mad at each other. So the technique that Lee mentioned, where we had the backs together and breathe. So they would be in a position where they're like, I can't look into the eye and not continue fighting or arguing. Then we're like, okay, you don't have to look at each other. Let's just, touch each other, start breathing, start calming. And a lot of sessions where patients are emotionally, beautifully so connected, begins like that, but ends up on a much positive note where they can find themselves, connect and appreciate each other.
That's great. So we have 1 minute left, and I'm just looking at the questions that we've gotten, and we did answer them. We had, how can yoga enhance the connection between couples, and why is that important? So we went over that. We had a couple of questions about what if the caregiver isn't interested in doing the yoga, so we covered that. If anybody else in the audience has a question that they think of after this webinar is over, this program, please feel free to email it to SIO, to info@integrativeonc.org, and they'll send it to us, and we'll make sure to answer it for you. And if anyone wants any of the research citations, please let us know and we'll get those to you. And we did put the link to Ms. Mallaiah's video in the chat, so you can go take a look at that. Ms. Mallaiah, would you like to sort of sum up or a closing statement before we?
Sure, surely. So I think in closing, all of us are impacted by cancer in some way or the other. We know from the statistics, 1 in 2 women, 1 in 3 men are all going to be exposed to cancer in some way or the other, even if it is not a personal diagnosis, friends, family, somebody going through. So if you can recognize the impact or stress of the cancer on other family members, you could do many things. Encourage them to seek support. If you are a yoga therapist or a yoga teacher who can give support, make sure that you encourage both parties. And this can be even a son or a daughter or somebody else who is supporting the cancer patient going through. And lastly, but not leastly, if you are a healthcare provider who see this, it can be actually cancer or others, encourage people to find support with practices like yoga therapy, mindfulness, meditation, things like that, which can contribute a lot. And it is much easier to be integrated without any side effects. And I would also say it is cost effective because we are in US and we love our economy to be stable, right? So thank you for this opportunity, Lee. Thank you, SIO, for this great opportunity to share some of the thoughts. Thank you.
Yeah, thank you so much. Thank you for joining us. And I'd like to thank everyone in the audience who came in today during lunch. Just a quick note, next week, next Wednesday at 12 o'clock, our show will be on adolescent young adults and the unique mental health challenges that this cohort faces, especially in the times of COVID when there's isolation and everything that goes with that. So thank you, everyone, and have a wonderful day. Bye-bye.